Leukemia can really be a life-altering experience. From one week, someone's healthy. The next week, they're told that they have to be in the hospital sometimes for a month, long chemotherapy, treatments that go on for perhaps a year or longer, and sometimes need to do a bone marrow transplant. Patients feel very vulnerable at that moment and feels that their whole life has changed. Leukemia is a disease of the bone marrow where the cells that normally reside in the bone marrow start behaving differently. Normally, the bone marrow cells divide and then mature up. In leukemias, the cells divide but don't mature, so they continue to proliferate and then start crowding out normal cells and interfere with production of the normal bone marrow elements. There's the acute leukemias where patients are sick acutely, all of a sudden. The cells grow very rapidly. Bone marrow function declines very quickly. And so patients typically present with bleeding. They'll bump themselves and they'll notice a large bruise, or sometimes even a bruise without bumping themselves. They'll notice that they get an infection easily. Wounds don't heal. The chronic leukemias, however, have a much more indolent course. The cells slowly grow. Patients become symptomatic over a year or two. There are a number of approaches to treatment for patients with leukemia. A younger patient who you're aiming to cure the disease, the first phase of the treatment is called induction therapy. It's generally given in the hospital. All patients need to get a central line placed to give the chemotherapy. The aim for most patients is to induce a complete remission, which means you don't see any evidence of leukemia in the blood or the bone marrow. And the patient's blood is normal. And then the next phase is to keep the disease away. So the next part of treatment would be regimens of consolidation therapy. This is generally given chemotherapy on a monthly basis. And the last is the patient's eligible as a potential donor or a match. Many patients doing a bone marrow transplant is a curative approach. Despite treatments getting much better over the last 20 years and treatments are tolerable, can be given in part inpatient and some outpatient. At the end of the initial treatment, patients look differently. They lose their hair. They lose weight. They're less vibrant. They lose muscle tone. They're more tired. They're not like they were before. And the patient needs to understand that this is expected. I reinforce that patients, and while they're going through this, it's very difficult. But generally at the end of a certain period of time, being 6 months to a year, they will look like they did before they met me. Tufts Medical Center is a specialized center in treating patients with leukemia. We have a dedicated floor, dedicated nursing staff, dedicated team of both physicians and ancillary personnel that are in place to treat patients with leukemia. And Tufts Medical Center has a long history of treating patients with leukemia. It's always been a referral center. For a disease like this, where the treatments really do have side effects, where for many patients it is a life-threatening disease, you want an expert who just does this every day. You want a nurse who has given this chemotherapy hundreds of times before. You want people who do this every day. That's why centers like Tufts, I think, thrive, because our approach to treatment of patients with leukemia is not just one individual. It's really a team of pathologists and nurses and other subspecialists who see as many patients with leukemia as I do, that all work together to have a positive outcome.